First technique I'm going to demonstrate is how to bury a staple line. I've got a simulated staple line across the length of small bowel. I'm going to bury that in order to reinforce that staple line to reduce the risk of leaking from the staple line. First thing to mention, the equipment. So I'm using a monofilament suture, and this is a 3O PDS. So it's an absorbable monofilament. It's on a small round-bodied needle, round-bodied so it splits the muscle fibres of the bowel rather than cutting them. And I'm using some forceps. I've got some non-tooth forceps here, so atraumatic forceps, because I'm going to be putting a bit of pressure on the bowel wall, so I don't want to use teeth on that. First important thing to say is that the bites of bowel muscle that you take in order to bury the staple line should be a decent distance away from the actual staple line. If you take your bites too close to the staple line, it's hard to bury that staple line. So you need a bit of distance to create that sort of envelope gap into which the staple line can be pushed and then sewn over. So we're going to start at one end. So I'm taking a muscular bite. It's useful to have an assistant who can push the corner in for you. I'm alone today, sadly. So take a bite on the other wall. So at this point, you'd normally give your forceps to your assistant, who would then do a bit of a maneuver to push that corner in. I have cheated a bit and sort of set it up ready so that I don't need the assistant. Okay, and then it's a monofilament, so I'm going to throw 7 throws, snug them down, alternate between forehand and backhand to try and get nice flat knots, and each one should be snugged down. I think that's 7, might be 1 out. At this point you can either put this on a clip if you want, or you can cut it. I'm going to cut it because it's not going to play a part in the rest of the technique. So I'm cutting it about 1/2 centimetre away from the knot. If you're too close, in theory it can unravel a little bit. Too long, it gets in the way, so just a decent distance. And at this point you will have an assistant who will be following for you to keep the tension on. Now the simulated bowel I've developed has got a rubber lining, so it grips onto the suture, so I don't need anyone to follow me, so I can practice, and you can practice by yourself with this kit. Okay, so again we're going to try and make sure we come in a straight line, don't migrate up the way and don't migrate closer to the staple line, because as I say, you'll run out of space and you won't be able to actually bury the staple line. So again, we're going perpendicular, taking a muscular bite. And your assistant can also make sure your stitches lay nicely. And keep you from tying yourself in a knot. And also it can help just keep the pressure on the staple line to bury it. And you're coming along 1/2 centimetre or so, again going in perpendicular, taking a muscular bite. Once you get going, I'm going to take this in 2 again. Once you get going, you can go in one movement across if it's safe to do so. Atraumatic forceps being used, like I say, because sometimes you do grip the bowel wall a little bit, which you don't want to do with tooth forceps. So at this point your colleague would get a hold of this to keep the tension on. Like I say, that the material grips the suture for us. So it's sitting nicely for us there, so it means I'm able just to take it in a 1er. And again, you can just use your forceps to guide the stitch down. muscular bites. In theory, they don't need to be full thickness, but you've got to get a bit of muscle to give it some strength. So you're not just taking sort of tangential serosal bites, which can tear and just cause serosal injury. So actually doing the opposite of what you want to do, making it less safe rather than more safe. As we're getting towards the end, I'm just preparing because of my lack of assistance, my lack of friends. I just want to make sure I don't run into problems trying to bury that last corner. Okay, so it's coming together nicely. I'm going to just prepare this. So I've got my second pair of forceps, they are toothed. Forgive me for that. So we're going to do that. So we're going to do that. That will work okay. The material is a bit thicker than bowel, so it doesn't behave quite as bowel would. You can wet the material, which makes it a bit more. Oh dear, I've swapped forceps. I'm using tooth now. There we go, back to atraumatic. Yeah, so you can wet the material, and it behaves a little bit more like bowel. However, it's also a little bit more messy. I'm going to get a bite down there. I'm just going to try and encourage that inwards. Okay, there we go. And probably one more here, beyond the corner. Actually, you don't lock. Okay, I'm going to pull this through. I'm going to do a final one. So that's it, fully buried. We've got the corner, so I can just go through to about the same place. Okay, and again, I don't want to lock it. It's not the end of the world, however. Okay, so and I'm going to tie, and again, I can just do a normal knot here, but with 7 throws. Snugging each one down. Losing count, I think that's 6, or is that 5? 6 maybe. 7, snug down, hold them up, and if you've got an assistant, they'll cut the stitch for you, and again, cutting it about 1/2 centimetre, too short, it can unravel a little bit. So that's burying the staple line. It's a reinforced staple line, so the risk of leaking from a staple line is small